Welcome to this video lecture on an intriguing case from the Journal of American Veterinary Medical Association. Today we will be discussing a 2018 case report about a clouded leopard who developed a rare condition, uterine mineralization, as a side effect of contraception. This case is a fantastic example of the intersection between zoo medicine, reproduction and diagnostic imaging. We will walk through the history, diagnosis and surprisingly positive outcomes and discuss what this means for clinical practice. Now, firstly, we'll detail about history. The patient is 4.5-year-old clouded leopard with 15.8 kg weight and sexually intact female. This is not a domestic cat but a clouded leopard, a valuable and often endangered species in a zoological collection. The clouded leopard was presented for just a routine examination. The main goal was to remove the contraceptive implant, that is melangestrol acetate, and to prepare her for breeding. Basically, the major history is contraceptive history. Melangestrol acetate implant had been placed in for 20 months prior, and she had previously given birth to healthy cubs, providing she was fertile before the implant. Now move on toward the examination. The physical examination finding of a firm tubular structure in the abdomen was the first red flag. In a normal animal, you shouldn't be able to palpate the uterus so easily. This prompted further investigation towards the clinical pathology. The normal blood and uterine results tell us this was not a systemic illness. The problem was localized, likely to the organ they could feel. Move towards the diagnostic imaging. Start by pointing out the enlarged tubular structures in the caudal abdomen. Explain that this is the uterus and it shouldn't be this prominent on X-ray in image 1. Then draw attention to the most critical finding. Look at the figure 2. The mineral opacity striation. Explain that this looks like faint white lines within the uterus. Soft tissue should not be mineralized. This is a clear sign of pathology. Now move towards the ultrasonography, the confirmation. In figure 3, ultrasound allowed them to look inside the uterus. They confirmed it was enlarged and fluid filled. This could be hydrometra or mycometra. The hyperquick bright white uterine wall on an ultrasound corresponds to the mineralized lines seen on the X-ray. Sound waves bounce off dense mineralized tissue, making it appear bright. The fact that the other organs were normal helped to rule out the other widespread disease. Now move towards the diagnosis and differential point. Final diagnosis is a two-part problem. One is the uterine mineralization, the primary issue, and the cause is directly associated with MGA use. This is a well-documented, albeit not extremely common, side effect of progestin-based contraceptives. Now look towards the differentials, what else it could have been. The first is metastatic mineralization. This is mineralization due to high blood calcium level, e.g. either from kidney disease or hyperthyroidism. Second one is neoplasia, that is cancer, a tumor that could sometimes mineralize, but the pattern and history made this less likely. Other uterine pathologies could be pyometra, inflammation of uterus, that is endometritis, and brain proliferation, that is hyperplasia. Moving towards the treatment, the only direct treatment was to remove the source of the problem, that is melangestrol acetate implant. This was done surgically without complication. The rationale use of the treatment: you can't reverse the mineralization that is already there, but you can stop the progression by removing the progesterone source. You halt that ongoing stimulus causing the endometrial changes, potentially allowing the body to undergo some remodeling. Third one is monitoring plan. Plan for serial imaging. This is crucial to see if the condition worsens, stays the same, or unlikely improves over time and to monitor future pregnancies. Now move towards the outcomes. This is the most remarkable part of the case. The patient, that is called Leopord, returned towards the cyclicity within just 6 weeks of implant removal. She showed estrous behavior. This proved that melangestrol-associated contraceptive effect was reversible and that her ovarian function was intact. She bred successfully and was confirmed pregnant via ultrasound 6 months later. This is the key takeaway of that case. Now move on toward the discussions and key takeaway. MGA, a double-edged sword, reiterate that MGA is a valuable tool. It's effective, reversible, and easy to use, but it comes with risk. This case highlights one of them, uterine mineralization, but other include serious issues like mammary cancer can be happen. Second one is the role of imaging in this case. This case perfectly shows the value of diagnostic imaging as a screening tool. The palpation finding was the clue, but radiographically made the diagnosis. Ultrasound then provided more detail. Third one is fertility implication. Fertility is unpredictable. This is the central learning point in this case. We know these lesions can cause infertility, but we cannot predict it for an individual animal.